Well, hello everyone, and welcome to another edition of You and Me and Multiple Sclerosis. My name is Pam, and I've been living with multiple sclerosis for nearly 37 years. And today, I thought it would be a useful thing for you to tell you a little cautionary tale. Today, I want to talk about health insurance and how difficult it is sometimes for those of us with chronic illnesses like multiple sclerosis to get the health care that we need. It all started when I went on disability from work. I had worked at my company for about 25 years, so I was well vested, and they were able to give me a generous disability package when I went off on disability in about 2007 or 8. It came with a nice health care package that the company provided that also had an HRA, a health reimbursement account, one for medical and one for drugs. So I was well covered there, but unfortunately, almost immediately, the company said to me, well, you need to apply for Social Security disability because if you're really disabled, you should be able to get that. Okay, so I'm living in the state of Washington at the time, and I go ahead and I apply. My doctor told me that I would not get it. He said, in Washington state, it's really difficult to qualify for Social Security disability insurance. If you're still breathing and you can sit up, they pretty much disqualify you, say you can't. Well, nothing daunted, I went ahead and I filled out all the application forms and I sent it in, and no big surprise, I was denied. Well, as I started thinking about the process of reapplying and all that kind of thing, my husband and I have been talking about moving back to the East Coast where we all have our family. My father had passed away in 2006, so my mother was living alone. And even though my brother was close, my sister wasn't that far away, it still seemed like maybe it would be a good idea for me to move back there and be a little closer. And my husband, of course, had family there as well. He's from Rhode Island, so his sister still lives in Rhode Island. And it seemed like a good thing to do, so we went ahead and we moved back to New York State. Well, the thing about New York, that its nickname is the Empire State, and you see that sign as soon as you cross the border into New York. But I keep wanting to change the name of New York State to the Welfare State because it kind of is. New York City is, of course, teeming with a population that requires a lot of services. And so the entire upstate New York is basically a support system, a life support system for the city of New York. That can be good and bad depending on what you need, because some of the benefits accrue beyond the borders of the 5 boroughs of New York City. And for me, disability insurance was one of those things. Once I got established in New York, I filled out the forms to get SSDI in New York State. And when I went to the place where they were going to have me meet with the judge and he was going to rule on whether I was qualified or not, it was a very interesting thing. My husband and I went into the room where he was, and we were hardly even in our seats when he looked at me and he said, I'm sorry, I was just assigned to this. I didn't get a chance to read your case file because if I had, I would have called you and said, you don't even need to bother coming because I've already approved it. I found fully in your favor. So here I was, SSDI without hardly even having to sweat it at all, which was, kind of an amazing thing to me, truly. SSDI is really nice insurance, by the way, because once you get it in one state, you pretty much can carry it with you if you ever move again. You don't have to reapply in the new state that you live in, which is 10 times better than SSI, because that you do oftentimes need to reapply for that every time you move to a different state, unless the state you're moving to has a reciprocity agreement with the state you're moving from, and that is not always the case. Anyway, so there I was, sitting pretty. I qualified for Medicare, so I got Medicare Parts A and B, and I still was doing the drug plan through my company because they had that HRA and all that. So I just said, okay, I'll just stick with the drug plan for my company. But my medical insurance was very nicely covered now. I had a Medicare Advantage plan that had no premiums, and it was really, really nice, actually. I was very surprised. I've heard some things since then that people say, well, Medicare Advantage is not generally the best way to go. But I had no complaints, believe me. I had to have cancer surgery in 2014, and it was, as I say, it was extensive. They had to open me up and remove a number of things in addition to the 10-pound tumor. They had to take out a few internal organs while they were in there. And the insurance that I had covered it really, really nicely. So I'm really grateful for that. Well, after we had lived there for a few years, though, the circumstances changed. My mother and brother decided they were moving to Vermont, so that left us in New York State, which, by the way, may be generous in terms of benefits like medical insurance, but it comes at a price because everything in New York State is really, really expensive. So we got kind of tired of paying the high taxes and the high this and the high that. So we just decided, you know what, we miss Washington. We've kind of kept our friendships and everything active back there. We still had the email address from Washington State. We still had the bank we were using. The credit union was still from Washington State. We thought, you know what, let's just go back. So I had SSDI, so I thought, okay, we're going to just slide in back and everything's going to be hunky-dory. But then I discovered the black hole of insurance. I moved to a county in Washington State that does not recognize that anyone under 65 is qualified for a Medicare supplement plan or a Medicare Advantage plan. Doesn't matter about disability. No, we don't care. The rule is you have to be 65. So here I am working on that. And it has involved, as you can guess, many, many phone calls.
Thank you for holding. All of our licensed agents are currently assisting other customers. In order to provide you with the best possible service, please stay on the line, and your call will be answered in the order received.
And many referrals to yet another place that's going to call. And every time they're very optimistic that they're going to get me something I can actually qualify for. And every time, no. So I've been told no a whole bunch of times in recent days. Every year I had called and to ask if things had changed, if the law in Washington or in my county had changed so that I would qualify now. No, no, no. The answer was no. So I'm in the middle of it yet again, going through this thing, trying to find out if there's any extra insurance for me. In the meantime, I still have been able to maintain my drug insurance, which is really nice, but I don't have the supplemental medical that I had when I lived in New York. So I've been very grateful that I haven't needed anything other than a CAT scan follow-up for my cancer once a year or so, and a few other doctor visits. I really haven't had a lot of expense that falls under Medicare Parts A and B. But I really would like to get a little extra insurance just in case, I need something. I mean, I do have MS. Something could happen. I'd kind of like to just feel like I'm more covered. How has your story been? Have you had the same kind of problem? Because I realize that many of us who get MS have to retire from the workforce long before 65. I'd love to know what other people's experience has been with health insurance, whether you're running into the same black holes that I'm running into. And if you have any suggestions for me that I haven't already tried, please let me know. I thought I'd turned over about every rock there was, but you never know. I might have missed something. Well, there you go. This is not really a complaint. This is more of a just information. And just a cautionary tale, if you're going to move from state to state, make sure you know what the rules are before you go. You may still make the same decisions, but at least you're not going to be unpleasantly surprised. Well, that's all I had for you today, and I really appreciate your listening. Please leave a comment, and I will see you again in my next video.